hey friends, today I want to walk you through a clinical case that reminded me why asking the right questions matters more than running the right tests. This patient came to me feeling completely unlike herself. She was exhausted, crying all the time, said something is off and I don't know what it is. And if you've been in practice for a hot minute, you know these kinds of patients walk in the door. I saw a ton of inflammation on her blood tests. So we ordered adrenal tests and a female hormone test. I'm going to show you exactly what I discovered, and it was surprisingly not what I expected. You've probably already guessed it by now by looking at the title, but hang with me. I'm going to walk you through the exact process, how I figured out what it was, and then what I did to help her get better. All right, hang on. Let's go. Welcome to the Clinical Entrepreneur Podcast. I'm Rhonda, your no-fluff, tell it like it is business bestie for wellness practitioners just like you who want to build a practice you love and make a bigger impact and a little money while you're at it. So if you're ready to ditch the overwhelm, attract your dream, ideal patients, and finally run your practice with complete confidence, you're in the right place. Each week, we're tackling things from programs to patient retention to marketing strategies that actually work, sprinkled, of course, with a little sass, a lot of heart, and the step-by-step strategies that will help you get there. So grab your cup of coffee, your notebook, or whatever keeps you going, and let's build a practice you love and a life you love together. Hey, friends, welcome back. Happy New Year. 2026 is here. We are starting a 6-week series called Clinical Thinking or Clinical Training, Clinical Thinking. And this is episode number 1, as I promised. And we are going to talk about the cracked tooth case. So I kind of gave away the answer in the beginning of the title, but I'm going to walk you through the whole thing, what happened. And this one was actually kind of a fun one. So here's the thing. I'll give you like all the background. So this is a female patient. She is someone who on paper looks beautiful, like impeccable diet, physically very fit, very, very active, great at self-care. She owns her own business. She doesn't have any history of anxiety or emotional upset or anything like that. Just a super solid human being. You would never expect that this individual would be coming in saying the things that she's saying. But when she came to me, she just said, I can't stop crying. I can't think. I am tired. I don't have any physical stamina. I can't figure out what's wrong with me. I don't know what's going on, but something is wrong. Something is wrong. I don't know what it is. Well, that's always a pretty gray area because how do you say something's wrong? I don't know what it is. I don't know. I'm going to have to try and figure it out now. I don't know what's wrong either. So as we're chatting, my first question is, well, when did you start feeling bad? Like that's always the first question. It's the never been well since moment, right? So I say, okay, well, when did you start feeling bad? She goes, I don't know. She said, well, I went to Croatia in the summer. So I just jumped to the conclusion, well, that had to have been it. You got sick while you were gone. Had to have been it. No, that wasn't it. And so I start digging a little bit more, asking a few more questions. And come to find out, this is not I've always struggled with stress. This was literally like a sudden onset, doing everything, all the right things. So she could not pinpoint a never been well since moment. So we ordered labs. We got the labs, got blood. We got an ASI from Diagnostic. We got a female hormone panel from Diagnostic, and cortisol looked fine. There wasn't anything wrong. So I'm thinking, okay, well, the adrenal glands are working and, her hormones were a little bit funny, but if she's got so much stress going on, that didn't surprise me. Her estradiol was low and, she just, you could tell it was just off. The HPO axis was just off, but I wasn't surprised because we got all this stress and crying going on here. So as we're, chatting this up, she tells me that she was in March, she was ready to go like all on this big, some kind of a physical athletic training thing. And she was feeling amazing in March. This is a recent case, just happened. Feeling so good in March. And then all of a sudden she didn't feel good. And I'm thinking, I said, what happened? I don't know. So here's the findings on her labs. You ready for this? Her CRP was 87. So we know there is some significant inflammation going on here. This is not just a little stressed and the CRP goes up a bit. Something is actively going on. Her fibrinogen is high. So that's another inflammatory marker. She didn't strike me as being like a cardiovascular kind of risky person. Cholesterol's fine. But here was when I went, okay. okay, something's going on in there. Her neutrophils were 72, the percent. Neutrophils were 72 and the lymphocytes were 11. And that screams bacterial. Something's going on. The body's fighting something. With all of those white blood cells being used, that was 83% of the white blood cells being used just on infection. Then she's only got a few percent left to deal with, like the monos, the basos, and the eosinophils. They were all bottomed out, of course. So I looked at this and I thought, okay, well, what else? Is there a blood sugar issue? No, her blood sugar was fine. There was no anemia. There was nothing else. Her glucose was 96, maybe a little high, or A1C 6.0. But I didn't think, well, that does not tell me why the CRP is up and why the neutrophils and lymphocytes are up. So cholesterol was fine. I said like 230, LDL's 132, triglycerides were good, lipids were good, all fine. Her alk phos was 40. And at first I was like, oh, hey, wait a minute. But she said that's super normal for her. So, okay, I'm not going to go there. So the clinical picture tells me there's significant inflammation. There has to be an infection going on, but there's no source. There's no fever. There's no illness. There was no never been well since. She wasn't sick when she went on vacation. None of that happened. Nothing. And this is where, in my mind, I'm thinking, well, I don't know, we're going to have to go deal with this stress and crying. So there's got to be something in the adrenal glands. See, I'm in a rut. I'm now judging myself looking back because you'll hear how the rest of the story works. But I'm just kind of down that road. So I said to the patient, okay, here's what we need to do. And here are the supplements that I'm going to recommend. I'll get them ordered for you on Fullscript and we'll get them. And we just kind of keep talking and talking and talking. As I'm thinking, is there an autoimmune component? There must be a gut infection somewhere. Because I always say if your CRP is high and it looks like a bacterial or a viral issue, then suspect the gut, suspect the gut. Because if you can't see it, in other words, there's not like a big infected sore somewhere or, a known, like they've got a respiratory issue or something, suspect the gut. So I'm thinking there has to be something in the gut. That's all. So I'm thinking, well, I'm going to address her adrenals. Let's see if we can get her to stop crying all the time, stop being so emotional, and get her back. So if she feels better and we get her out of the sympathetic stress response, then certainly she'll start feeling better. Her energy is going to come up. So I'm, in my mind, I'm kind of making my protocol. I'm thinking, okay, this is how this is going to go. But here's where the high point of the conversation happened. At the very end of the conversation, very end. I mean, we're an hour in now, and I've asked every question that I know to ask, every question I know. And all of a sudden, she says, out of the blue, well, I'm not sure if this matters, but I did have a weird thing happen with my tooth a few months ago. And I said, really? Tell me more. So here's what happened. And this was an incidental finding for her. She just dropped it. Oh, well, this was maybe in the summer, had nothing to do with her vacation plans. In the summer, she had her teeth cleaned. Everybody gets their teeth cleaned. No big deal. 2 weeks later, she has a horrific nightmare, and she's not prone to nightmares. I mean, so really bad nightmare. And she woke up with incredible amount of pain in her mouth, and she had a cracked tooth. It had cracked. And she said, I just thought that I was probably so stressed from the dream that I was, I clenching down so hard that I cracked the tooth. So she goes, they pull the tooth. They pull it. When she goes on vacation, no problem, comes back, not sick, everything's great. She comes back and the site where they pulled the tooth, it all healed. So now they're going to put a post in and for the new tooth they're going to put on. So they put the post in and she has it placed, and 24 hours after she has it placed, she said, I just didn't feel right. She goes, it's just weird. I don't know. I just felt weird, almost like I had the flu. And then after it was like a little low-grade fever, and then 24 hours or a short amount of time later, the fever kind of broke, and then I was fine. And I just it was one of those slap in the forehead, oh my gosh, this is the infection. This is what's happening. And as soon as she described that moment where she had the fever, it kind of broke. I was and my brain, and then all the little pieces start to fall into place. So here's what happened. The tooth that was cracked probably wasn't healthy to start with. So there was probably some kind of cavitation, or there was a previous filling or something. But a nightmare, people have nightmares, but not everyone that has a nightmare wakes up in the morning with a cracked tooth. So I think, there's two plausible explanations here. One is that the tooth was already compromised. compromised. And that could very well be. The second one is that as a result of the tooth cleaning that she had, the mouth teeth cleaning, that around that tooth, there may have been some kind of bacteria that got dislodged and then got down inside that tooth. And then 2 weeks later, she had the nightmare. The nightmare could have been caused by the bacteria. I mean, that's very, very possible. So it's one of those two things, right? One of those two things. So the cleaning could have released the bacteria, or she could have just had a weak tooth already. So she wakes up, cracked tooth, horrible pain in her mouth. They pull the tooth. Nobody thought that there was an underlying infection. You just go, oh, you have a cracked tooth. We're going to pull it. Okay, no problem. And then when the dental post was placed months later, it likely disturbed that pocket of infection again, which is why she had that 24-hour fever. And so now all this time, I mean, we're 6 months into this now or more, and all this time, this infection has been like festering. And as it festers and festers and festers, how it was manifesting was all of that emotional dysregulation. It wasn't adrenal dysfunction, but the infection made her body not feel well. And she said she was ready. As we were talking about it, she's like, that makes total sense, because in March, she said, I was feeling the best that I had felt in a really long time. And I was ready to go do some competitions and, I don't know, weightlifting or whatever she's into. And she said, I like someone pulled the plug. I have no energy, nothing. And that's why, because her body's fighting an infection. So this is why I always say, you always have to ask that never been well since. You have to ask that question for sure every time. But even when the symptoms don't add up, which for her, it was not adding up for me. I could not figure it out. It wasn't adding up. I just kept asking and asking and asking, and I kind of was out of askings. And then she dropped the little nugget. This might not mean anything, but I did have a tooth pulled. So now that I knew what we were dealing with, here's what I did. So first, I said, well, we've got to clear up that infection. So my go-to always is the stealth pathogen protocol. Always. And that's from Standard Process. If you're not familiar with it, you should be, because it is amazing. So I explained to her what the stealth pathogen protocol was. And I said, here's how we're going to do it. 4 days on these 2 supplements, 10 days on these 2 supplements. You're going to keep going. I want you to do it for 3, maybe 4 months. Don't skip. Just keep rolling. There's 2-week cycle. And again, if you're listening and you're not familiar with what that is, you can message me and I will send you the little one sheet that I give to patients that kind of explains how to use it. But it's from Standard Process. I then I said, let's get you some herbal throat spray. I mean, there's lots of people that have this. I just use the one from Standard Process or MediHerb. It's called herbal throat spray. And I wanted her to spray it in her mouth on where the tooth was, the post is, because the post is in there. Now, I don't know if it's going to get through the tissue down into the gums. I don't know, but it's got all kinds of antibacterial. It's got myrrh, it's got cloves, it's got echinacea, all the things in there. It doesn't taste real great, but at this point, we do not care. I said, let's get the antimicrobial support right at the source. So that was what I had her do. Then once we kind of have that, the secondary sort of support, and we sort of agreed on a little bit of a compromise so that I wasn't giving her too many supplements. I said, let's just start with something that's going to give you some emotional balance. Like, I don't think we're going to get rid of the emotional piece until we get rid of the infection, because the infection is the never been well since moment. That's where all this came from. So now what we want to do is we want to get in and start to stabilize the symptom. That's the way I'm thinking. But now I know it's not the emotions that are the problem. It's the infection that's the problem that's causing the dysregulation in the emotions. So I chose Neviton from Standard Process. I love that product, but I could have also chosen Emotional Balance from Gaia. That's a good one. Or even Ashwagandha Forte would have worked. Like, all of those would be fine. And I gave her a dose of 4 per day. I said, you don't need much, just 2 in the morning, 2 at night. You're going to be fine. And then because her hormones were a little bit wonky, the hormone support, I probably would have just done Chastry, maybe some Ovex. Again, these are Standard Process products, but you could use like some doctor's research, Complete Female. There's several different things you could use. But the female support was kind of secondary for me. What was primary was A, infection, B, getting the symptoms calmed down, the emotional symptoms, and then 3, my kind of third priority was addressing the inflammation, because I knew that there was some inflammation. Obviously, that CRP is high. The first thing I'm going to think of, if it's not in a joint or the lungs, I'm going to think about turmeric. So I use Turmeric Forte from Standard Process, but there's lots of other good turmerics out there. That's just the one that I used. And then because her fibrinogen was high, I had her get on nattokinase. And I told her to get a little bit of probiotic. Just pick your probiotic, just so we kind of covered that gut issue, right? Just a good probiotic. The nattokinase kinase that I love is from Doctor's Research because it's a food-based natto. So I like that one. So I recommended that for her. So really her protocol is pretty simple. So let's recap. Stealth pathogen protocol, I did that, and the herbal throat spray in the mouth. Then I gave her one thing for her emotional just to see if we could settle that a little bit. I gave her something for the inflammation and something for the clotting, the high fibrinogen, and then a probiotic. So see, my protocol is pretty small. It's pretty small, but she's going to feel so much better. So notice what I did not do. I did not throw a whole bunch of supplements at her, and I did not order a bazillion dollars in testing because she was so dysregulated and because I knew that she would want to know. She was one of those patients that I just need concrete information. I didn't mind ordering the tests that we did, but what I wasn't going to do was order a big old stool test and a pathogen test. No, because I know what the problem is. I don't need all those tests to tell me where to go. So the dental post situation isn't going to be completed for another 3 months, which is great because now I've got 3 months. What I don't want is I don't want that tooth to get placed on that post until we get the infection gone. So we've got time to work on it, and it can stay, she can put it off for a little bit longer. So the infection is the number one priority. So that's the thing. So when I think I've learned this over 20 years of experience that if I don't have good follow through, this is where I'm going to drop off with this patient. So I now have her on a time-sensitive protocol, and I'm watching. So what's the very first thing that I know I'm going to think through? Well, I want to retest. I want to see what the CRP is doing. I want to see what the fibrinogen is doing, and I definitely want a CBC. Not really worried about her blood sugar right now. That's for later conversation. Her hormones are going to be fine. But I know that I need to retest. So the question is, when do I retest? Well, my thought is I'm going to retest in probably 3 months when she's done with that stealth pathogen protocol. But I know myself, and I know that my tendency, if I don't have some kind of structure in the follow through to make sure that follow-up test gets ordered, I'm going to miss it and forget because I'm doing 100 other things. If you listen to last week's podcast, you'll know this follow through thing is I'm doing all of the work right now, and I have to be good about the tactical business side of it to do the follow through. So I made a note. I use Practice Better. So I made a task in there to order the retest for her, the blood retest, because I want to see what's happening with the CRP, the CBC, the neutrophils, lymphocytes. They'll respond pretty quickly, and the CRP should go down nicely as well. So I created a task for myself, got the supplements all ordered for her, and I wrote up the protocol for her in Practice Better, and then it's also in Full Script. And then I gave her the resource, she needed a resource. I have all of those loaded in Practice Better, so I just assigned that resource to her about how to do the stealth pathogen protocol, and then made sure that all my tasks were in place, and then I can wipe my hands, and she's off. She's got the supplements coming her way, and she's going to be just fine. She was so thankful, and I was too, because I was scratching my head. Where is this infection coming from? I was thinking it's got to be in the gut, and then I'm thinking, okay, I'm going to have to do a parasite cleanse, cell core. That wasn't it at all. It was in her mouth. Good grief. So here's what I want you to take away from this clinical thinking episode 1. Number 1, I find more often now that the obvious answer is not always the right one. There's a rule they call it the 30-30-30 rule. And the 30-30-30 rule doesn't add up to 100, but just pretend it does. 30% of the time, the first answer isn't going to be right. The second 30% of your thinking is going to uncover some version of the first one, just a different variation. The third 30% of your thinking is going to really be where the answer is. And that's really what happened. I'm like, well, this has got to be for sure. It's a slam dunk endocrine issue. She's crying all the time and she's tired. For sure, endocrine. Her thyroid numbers look good too. I ruled that out. But it wasn't. But the second third of my thinking is okay, well, maybe it's gut. Maybe there's a parasite that's affecting her emotions. And then finally, we get to it at the end. I would have gone down a whole nother rabbit hole had she not dropped that little nugget. So keep asking. If something is not adding up, you do not need to order more tests. I did not need to order a stool test and a parasite, a Cyrex. No, I didn't need to do any of that. I just had to keep asking. And something that I said made her say, wait a minute, this might not mean anything, but this is what happened. So if you don't have in your intake forms a dental section, you might want to. You may want to add something that just says, what is your dental history? And had she filled that out, I would have known. So there you go. That's the thing. We want to make sure that there's a dental thing. So guess what I did? Went and added that to my intake form. So now I'm asking about dental history. It used to be there. No one ever filled it out because they're like, I don't know what tooth it was, so I took it out. Well, here we go. I should have left it in because that would have been the best if I had done that. So there you go. There's the first clinical thinking case, episode 1. We've got 5 more weeks of this. But before we go, I really want you to know if thinking through these cases or not knowing where to start, I hear this all the time from practitioners. If you want to learn how to think like I think and walk through these cases like a step or 2 at a time, instead of just relying on a protocol from a book. Like back in the day, we had these CRGs from Standard Process, and they were full of protocols. And that's how I cut my teeth. I used those protocols. But if we had it on a scale of good, better, and best, they're on the good side and maybe underneath good because they're cookie cutter. And a cookie cutter protocol never works. What I teach inside Clinical Academy is the way that I think, the way that I process through a test, the way that I'm asking questions and digging a little deeper and thinking, oh, well, it must be this. Wait a minute, it's not that. Well, if it's not that, then what must it be? And I'll teach you how to do that. That's why there are, with dozens and hundreds and hundreds and hundreds of different conditions that you're going to see every day, every week, every year in your clinical practice. If you need help thinking through those, I would love it if you would join me inside Clinical Academy. Go click the link in the show notes. You can find me at rhondanelson.com/Clinical Academy. Next week, I will be back with another case, a different patient, a different puzzle, and a different approach. I'll show you how I solved that one next week. Take care. Have a great week. I'll see you then. Hey, listen, friend, before you go, if you want to follow me along on this clinical thinking series, I put together a 1-page guide called The 6 Principles of Clinical Thinking. This is the exact framework I use to work through every single case. It's the questions I ask, the order I think them in, and the mistakes that I've learned to avoid. So grab it for free, rhondanelson.com/6 principles, the number 6 and then principles. This will help you get so much more out of these episodes. And honestly, it'll help you with every single patient case that you work with. So grab it. It's free. Go get it. rhondanelson.com/6 principles. Next week, I'll be back with another case that I've solved, a different patient, different puzzle, and a whole different approach. I'll show you how I solved it. So take care. Have a great week, and I'll see you then.